This is my analysis of plot and theme in Margaret Edson's play, Wit. Vivian Baring is a professor of 17th century poetry specializing in the holy sonnets of John Donne. She is the narrator and main character of this play, and she often addresses the audience directly, breaking the fourth wall. In fact, this is how the play begins, when she talks about how it feels to be asked, "How are you feeling?" when she is obviously very ill. She says, "They'd given me less than 2 hours," and creates a poetic metaphor saying the sands of time slipping through the hourglass, the 2-hour glass. This is a one-act play. There is no intermission or breaks in action between scenes, only changes in lighting and costumes. The play incorporates flashbacks to structure the plot. Through the flashbacks, the audience is able to see different parts of Vivian's life, such as memories from childhood, interactions with former students, and old teachers. It does not go from one date to the next. It is Vivian's internal thoughts that drive the story forward. The last line of her beginning monologue says, "I'll never forget the time I found out I had cancer," and it leads into the scene where Vivian's doctor diagnoses her with stage 4 metastatic ovarian cancer. The play becomes more chronological towards the end when Vivian is in extreme pain on a morphine drip and no longer well enough to have an internal monologue or coherent interactions. The present themes that I will be exploring are death and mortality, empathy versus professional detachment, and kindness and human connection. The story begins with Vivian's opening monologue where she introduces herself, her circumstances, and the medical professionals that are overseeing her care. We learn that Vivian is undergoing an 8-month-long experimental and intensive chemotherapy treatment. The doctors that oversee her treatments are Dr. Harvey Kellican and his medical fellow, Dr. Jason Posner. It's revealed that Vivian was once Jason's teacher, and she expresses her discomfort when she realizes their roles have been reversed, as Jason is now responsible for her care. Susie Monahan is the empathetic, attending oncology nurse who is ultimately the only staff member that offers Vivian comfort and dignity and human connection. The rising action follows Vivian's growing realization that she's going to die. In the very beginning of the play, she treats her cancer diagnosis as an academic problem that can be solved, like a John Donne sonnet. But as she becomes sicker, she becomes more fearful of death. When Vivian has accepted that she's going to die, she chooses to sign a do not resuscitate order, even though she understands the importance and her importance to medical research. The climax comes when Jason comes into her hospital room to realize that Vivian's heart has stopped. He calls a code blue and tries to revive her. During the falling action, Jason stops trying to revive Vivian, and the code team is upset that they were called. They berate Jason for not following a patient's orders because what Jason did is considered assault. During the resolution, Vivian's soul is released from her body and she walks towards the light. The theme of death and mortality seems clear because this is a play about a woman with terminal cancer. The play seems to point out the inevitability of death and the struggle to find meaning in the face of mortality. It's made apparent to the audience that Vivian's time is numbered. She says, "It is not my intention to give away the plot, but I think I die at the end." The use of the word think displays Vivian's difficulty to accept her fate. Vivian's academic focus on the poetry of John Donne highlights her belief that she can solve death and understand her own mortality, like she would solve and seek to understand poetry. There is one scene in particular where Vivian addresses the audience in a way that a professor would address a classroom full of undergraduates, laser pointer and all. She says, "The greatest wit, the greatest English poet, some would say, is John Donne." In the Holy Sonnets, Donne applied his capacious, agile wit to the larger aspects of the human experience, life, death, and God. It appears that Vivian is trying to work out an academic problem, but in this case, it is her own mortality. But as a John Donne scholar, she's aware that while Donne addresses questions on these subjects in his poems, there is no resolution. Susie interrupts Vivian's thoughts when she enters the room to take Vivian to get an ultrasound. Vivian protests, saying, "It should not be now. I am in the middle of this. I have this planned for now, not ultrasound." This disruption brings Vivian back to her own reality, but is exemplary of Vivian's unwillingness to accept her death as she attempts to understand her own mortality. Wit aims to critique both the medical profession and academia. Pursuits in these fields often encourage a person to focus on a specialty, and this can come at the expense of personal and individual relationships. The very first line supports this theme. Hi, how are you feeling today? Every time Vivian's doctor enters the room, they ask that question, and it doesn't seem to come from a place of concern for her feelings at all, but rather a routine phrase doctors use to fulfill clinical skills or bedside manner, which is a set of guidelines medical professionals are trained to follow when they interact with patients. Vivian humorously comments on this repeated phrase, saying, "I'm waiting for the moment when someone asks me this question and I am dead." The medical fellow that oversees Vivian's care has never been unkind to her, but he also does not have personal interactions with her. At one point, Vivian came to the hospital after a round of treatment feeling very ill. She had to be isolated because the chemotherapy treatment compromised her immune system. Jason complains about needing to maintain sterility when he comes into her room to monitor her. In the following scene, Jason enters the room and goes directly to the graph on the wall that they use to keep track of Vivian's fluid intake and output, and he eventually realizes that he's required to offer his patient bedside manner. In this realization, he says, "Oh, geez, clinical. Professor Baring, how are you feeling today?" When Vivian was really suffering from the effects of chemotherapy, Susie suggested to Jason that during the next cycle of treatment, Vivian's dose should be lowered to a less traumatic level. He dismisses the idea, saying, "Full dose, she's tough, she can take it." But in reality, Jason doesn't want to lower the dose because it would affect his research data. A flashback reveals when a student who recently experienced the death of a family member asked Vivian for an extension on an assignment. Vivian refuses to give them more time, emphasizing her professional pursuit of knowledge over empathy. As she recalls this memory, she says, "I don't know, I feel so much, what is the word? I look back, I see these scenes, and unable to finish the thought, she returns to her hospital bed. She considers how people will move forward after she dies, predicting, well, first my colleagues, most of whom are my former students, would scramble madly for my position. This further supports the theme as Vivian acknowledges the coldness and competitiveness of academia even when faced with death. The most exemplary display of this theme was the ending. At this point, Vivian has decided that should her heart stop, she does not want life-saving measures to be taken and signs a DNR order to that effect. When Vivian inevitably dies from her terminal illness, Jason tries to revive her, going against her medical orders. Susie protests that she's DNR, to which Jason responds, "She's research." This play explores the significance of human kindness and connection when confronted with suffering. It is very clear that Vivian is alone in the world. She has no close friends or living family to support her through this harrowing journey. She has dedicated her life to academia and in the process sacrificed human connection. For the majority of the play, Vivian responds to the question, "How are you feeling today?" by simply saying, "Fine." As she experiences the indignities of dying in a hospital and the lack of human connection that follows that, Vivian begins to show that she craves kindness and she wants to be treated like more than research. She asks Jason, "Are you going to be sorry do you ever miss people? And what do you say when a patient is apprehensive, frightened?" To which Jason replies, "Of who?" which displays that he has no intention of emotionally supporting his patient through her death. Vivian pinches her IV line, creating a reason for Susie to come and check in on her. During this scene, Vivian admits that she is scared, and Susie comforts her during this time, offering her kindness, human connection, and a popsicle. The last few scenes of the play, Vivian is no longer coherent. Her mentor, who is now 80, comes to visit her in the hospital. The kind woman offers to recite John Donne. But due to the morphine and the terminal cancer, Vivian is no longer able to withstand or process the complexities of John Donne. So to comfort her, Ashford crawls into bed with her and reads her a children's book. This interaction is Vivian's last, but in this moment she is given the human connection that she has needed since being made aware of her terminal diagnosis.